With us today from Marshall, we have President Gilbert, and from the medical school, we have Dean Joseph Shapiro and Vice Dean Uma Sundaram. We also have in the audience here somewhere, I lost track of her, our Vice President of Federal Programs, Charlotte Weber. Where are you, Charlotte? There you go. We're here today to announce the renewal of an important award from the NIH that reflects the collaborative, enterprising spirit of Marshall, and also to give you some important updates. In the 5 years between the first award and this renewal, there's been dramatic growth and progress in Marshall's biomedical research. And it is my pleasure to introduce Dr. Gilbert, the 37th president of Marshall University, to make the announcement and tell us about his plans for research at Marshall University. Dr. Gilbert.
It is an exciting day for Marshall University because we are taking another step to affirm our commitment to making a difference in our community by being a leader in research. We are announcing today a continuing partnership with the University of Kentucky as part of the National Institutes of Health's prestigious Clinical and Translational Science Awards program. NIH is awarding $19.8 million to support UK's Center for Clinical and Translational Science. Through the CTSA partnership with UK, Marshall will be awarded $640,000 subcontract over the 4-year grant period to fund scientists in our clinical research program and to continue building a health informations program. I should also point out that the Clinical and Translational Science Awards are relatively new awards at NIH to help researchers develop ways to reduce the time it takes to take discoveries from the laboratories and turn those into treatments for patients. Marshall has made great strides in the past year to expand our research, and my goal is to double that research in the next 5 years. Recent NIH funding, NSF funding, and other funding sources are helping us move toward that goal. I am proud of our faculty members and our researchers, and we are delighted to be a part of this University of Kentucky partnership. Thank you.
We're very, very pleased about this partnership. As Dr. Gilbert indicated, it's our interest and our passion to become a more research active university and to be a leader in clinical translational research. This partnership with the University of Kentucky is frankly much more important than the dollar figure because this establishes Marshall and our healthcare delivery system as a potential clinical hub for clinical research going forward. And that's going to be very important in future years as NIH supported clinical research studies are funneled through these clinical hubs around the country. Again, I think this is a very important step towards our becoming a more research active institution. And I'm very proud of the man to my left, Dr. Uma Sundaram, who's spearheaded this effort. Dr. Sundaram is our Vice Dean for Clinical Translational Research and is an extremely well-published and well-funded investigator in his own right, having just received his second contemporaneous R01 grant from the National Institutes of Health. Without further ado, let me introduce Dr. Sundaram.
To get a grant like this, you really need to have an outstanding, dedicated team of professionals working with you. And I was very fortunate when I came here 3 years ago to have such a group of people as we started the Institute, as we continued funding with the CTSA. So I'd really like to introduce those folks who are truly responsible for everything that's happened here, and without them, this absolutely would not have happened. First, Dr. Todd Gress, my Assistant Dean for Clinical Translational Research. Dr. Al Sacchetti, who's our Director of Clinical Informatics. Dr. Todd Davies, right next to him, who's our Director of Clinical Trials. Drs. Todd Green and Richard Eggleton, who are the co-directors of our graduate program. And Dr. Shah and Jennifer Pymel are not here. I don't see them. And they're also part of this institute as co-directors and have been instrumental in getting this done. And, you know, without a doubt, you need to have a great staff if you're going to do anything like this. And I've been blessed to have a wonderful staff, and I'd like to recognize them as well. Kelly Gelman, where's Kelly? There's Kelly, hiding behind her cell phone. Chris Schaefer, J.T. Snyder from Merck, and last but certainly never least, Becky Smith. I also want to go ahead and thank our institutional leadership for the support they provided. Without them, this would not have happened. This is very much a part of Dr. Shapiro's vision for the medical school and the university. I'd like to thank him. Also, Dr. Marr. We've been doing this for some number of years, including when I was up north. And I'd like to thank Dr. Marr for his continued support. And it's been wonderful to have Dr. Gilbert, who really raised the bar for us in terms of doing research here compared to what he's done down in Mississippi. So we certainly got our work cut out for us. I just want to say that, you know, a grant like this, as Dr. Shapiro said, it's not so much about the money. You know, it's really about doing better for our patients. I've been practicing in West Virginia now for more than 12 years as a gastroenterologist, and I firmly believe, you know, it's not enough for us to just keep doing more of what we've been doing. It really needs to be better, okay? We really need to provide the best possible advanced care for our patients. What this grant does is it positions Marshall as the university in the state to do just that. Because even though we have a lot of healthcare disparities in the state, we've had very little to no access to advanced care. The greatest and latest in medical science usually goes to large institutions that have these CTSA grants. So it's really important for us with our healthcare disparities to have available for our patients the kind of advanced care that a CTSA institution brings. So more than, you know, the money from this grant, our primary goal has always been for Marshall to be the nationwide consortium partner for CTSA and be the clinical hub for West Virginia to take care of our patients. And I think with this partnership with the UK, Marshall indeed will be that school in West Virginia. Thank you.
First, let me echo the wonderful comments we've heard today. This is truly an advance for the medical school and continues a partnership that started several years ago. And I think it's one of the partnerships that really lets us advance the efforts that Dr. Sundaram has started and develop them more fully. I think one of the things that some of you may know is that we recently reorganized the basic science departments within the School of Medicine. And I think in doing so, it positions us much more strongly to get our basic scientists involved in interacting with our clinicians to help advance clinical and translational research. And actually, this partnership with the University of Kentucky is going to advance that even further. So I think that's a very strong sign and a big help for what we're trying to accomplish here at the university. We are also beginning to explore some interactions with the West Virginia Clinical and Translational Science Institute at W.Va. This partnership that we're beginning to explore is one that will allow us to interact with their CTSI, one that interacts also with the University of Kentucky. So we're actually strengthening through these interactions our ability to conduct clinical and translational research across the entire region. And I think all these activities are going to help even more with the programs that Dr. Sundaram has started. So we're really solidifying, we're enhancing, we're generating synergy, and I think it's going to make a really big impact on the health of people in our region. So all of these interactions we have going on today, let me congratulate everyone that's involved. I think all the people that have been mentioned today are a critical part of what we're trying to do here at Marshall, and I just see us getting better and better and better.
Okay, well, that concludes our event for today, and I think the theme that you heard here is how Marshall's collaborative spirit is positioning it as a hub for this region to deliver advanced health care in the best way possible. So thank you again for your attention, and the principals will be available for individual interviews afterwards. Thanks again.